Hi, I'm Tara Winward, and I'm going to be doing the IM injection. So first, I would verify the medication order. The medication order is going to be morphine, 4 milligrams per ml, but that's the medication that we have on hand. The order is to give 6 milligrams of morphine per IM for 1 dose. So doing the math on that, I figured I need 1.5 mLs would equal the 6 milligrams of the morphine per the 1 ml. So it would be 1.5 mLs. So then I would verify the patient's 6 rights. So it would be the right patient, right dose, right route, right medication, right time, and right documentation. Then I would gather my supplies and knock on the door, provide privacy, and introduce myself. My name's Tara, and I'm here to give you your morphine shot. I would verify the patient by 2 identifiers, so name and date of birth. And then I would also ask the patient if they have any allergies, seasonal, environmental, food, drug. Then I would let the patient know that morphine is a pain med for severe pain, and the side effects could be pounding heart rate or pounding heart, chest pain, drowsiness, nausea, vomiting, any of those. And if any of those become too much, contact your doctor. I would allow the patient to ask questions. Then I would again, I would perform hand hygiene. Well, first I'd locate the, well, I'll perform hand hygiene. I'll put on my gloves. And then I will locate on my patient where I'm going to give the injection. So on my patient, I would give the patient the injection in the deltoid muscle. So this is my patient's arm, and this is their shoulder, like up here. I would locate the cranium process about 2 finger widths down. And then that's the muscle. And then in the middle of the muscle is where I would give the injection. So I would assess the skin, make sure that there's no bruising, lesions, masses, make sure there's no tenderness. If so, I would rotate to the other side. I would clean. Let me pull my medication first. Okay, so first I would clean my vial with an alcohol swab to ensure I'm not cross-contaminating or anything. And then I'm going to do 1.5 mLs. So and pull back the air there. Pull back 1.5 mLs. Ensure that there's no air bubbles. And there is 1.5 mLs, which equals 6 milligrams of morphine. I would clean the patient's skin in a circular motion from the inside out. Let that dry. Going at a 90-degree angle, so I would pull the skin tight. 90-degree angle here. Make sure my bevel's up. I'd go straight in quickly so we don't have any pain. And then I would hold this needle here steadily. And I do about 10 seconds per ml. So we got 1.5, so I'll do about 20 seconds maybe, just to ensure that I'm not causing any pain or anything. Then I would hold it steady here for a minute to ensure all my medicine got into my patient's arm. I would have a gauze pad here. When I remove it, I will remove it. I would activate, I won't massage the area. I'd activate a safety, or I'd activate the safety. Of course, this one doesn't have one. And then I would dispose in the sharps container. Make sure there's no bleeding, make sure my patient's okay. And then I would remove my gloves, get rid of my mess, perform hand hygiene, and document the procedure. Thank you.